Unmasking melanoma, recognizing suspicious moles, mastering sun protection, and navigating treatment on HealthSphere. Welcome back to HealthSphere, where we empower you with vital health knowledge. Today, we're diving deep into a critical topic: melanoma, the most serious type of skin cancer. While potentially life-threatening, melanoma is often curable when detected early. It's understanding how to spot suspicious signs, adopting effective sun protection habits, and knowing the available treatment options are your strongest defenses. The skin you're in, understanding moles and melanoma. Our skin is the body's largest organ, and it's constantly exposed to the environment. Moles, also known as nevi, are common growths on the skin that develop when pigment-producing cells grow in clusters. Most moles are harmless, but some can develop into melanoma. Melanoma arises when melanocytes become cancerous. Melanoma can appear suddenly as a new mole or develop within an existing one. It's crucial to become familiar with your skin's moles and patterns so you can recognize any changes. Regular self-examinations are key to early detection. Spotting the danger. The ABCDEs of melanoma. Learning the ABCDE rule is a simple yet powerful tool to help you identify moles or skin lesions that could be melanoma. If you notice any of these characteristics in a mole, or if a mole looks significantly different from others on your skin, it's time to see a dermatologist for evaluation. Let's break down the ABCDEs. A is for asymmetry. Most benign moles are symmetrical. If you were to draw a line through the middle, both halves would roughly match. Melanoma lesions are often asymmetrical, meaning the two halves look distinctly different. B is for border. Benign moles typically have smooth, well-defined borders. Melanoma often has irregular, notched, scalloped, or blurred edges. The pigment might also spread into the surrounding skin. C is for color. Harmless moles are usually a single shade of brown or tan.
Melanoma
lesions often have uneven coloration, with multiple shades of brown, black, tan, red, white, or blue within the same mole. The color may not be uniformly distributed. D is for diameter. Melanomas are often, but not always, larger than 6 millimeters when diagnosed. However, it's important to remember that melanomas can be smaller, especially in their early stages. Any mole that is growing should be checked, regardless of its initial size. E is for evolving. This is perhaps one of the most crucial signs. Any change in a mole's size, shape, color, height, or surface is a warning sign. Moles that are evolving over weeks or months should be promptly examined by a doctor. This includes new moles that appear suddenly and change rapidly. The E can also stand for elevated or firm, as some melanomas can become raised or feel firm to the touch. Regularly examining your skin head to toe, ideally monthly, is essential. Use a full-length mirror and a hand mirror to check hard-to-see areas like your back, scalp, buttocks, and the soles of your feet. Pay close attention to areas exposed to the sun, but remember that melanoma can occur anywhere. Even in areas rarely exposed to sunlight, such as the palms of the hands, soles of the feet, under fingernails or toenails, and even in the eyes or mucous membranes, shielding your skin. Effective sun protection strategies. Excessive exposure to ultraviolet radiation from the sun or artificial sources like tanning beds is the primary preventable cause of melanoma. Protecting your skin from UV rays is the most effective way to lower your risk. Sun protection should be a year-round habit, not just limited to sunny summer days. UV rays can penetrate clouds and reflect off surfaces like water, snow, and sand. Here are comprehensive strategies for effective sun protection. Seek shade. Avoid direct sunlight during the peak intensity hours. It's typically between 10 a.m. and 4 p.m. if your shadow is shorter than you are. The sun's rays are strongest. Seek shade under umbrellas, trees, or awnings whenever possible. Keep in mind that shade doesn't offer complete protection from scattered or reflected UV rays. Wear protective clothing. Clothing is an excellent barrier against UV radiation. Choose tightly woven fabrics, which offer better protection than loosely woven ones. Opt for darker colors, which tend to absorb more UV rays than lighter colors. Wear long-sleeved shirts, long pants, and skirts, especially during peak sun hours or extended outdoor activities. Look for clothing with a high ultraviolet protection factor label, indicating how much UV radiation the fabric blocks. A UPF of 50 means the fabric allows only 1/50th of the UV radiation to pass through. Wear a hat. A hat with a wide brim is essential for protecting your face, scalp, neck, and ears, areas prone to sun exposure. Baseball caps offer some face protection, but leave the neck and ears exposed. Wear sunglasses. Protect your eyes and the delicate skin around them by wearing sunglasses that block 99% to 100% of both UVA and UVB rays. Wraparound styles offer the best protection by preventing rays from entering from the side. Apply broad-spectrum sunscreen generously and frequently. Sunscreen is a crucial layer of protection for exposed skin. Use a broad-spectrum sunscreen, meaning it protects against both UVA and UVB. Choose a sunscreen with a sun protection factor of 30 or higher for daily use. For extended outdoor activity, an SPF of 50 or higher is recommended. Apply sunscreen liberally to all exposed skin at least 15 to 30 minutes before going outdoors. Most adults need about 1 ounce to cover their entire body. Reapply sunscreen every 2 hours or more often after swimming, sweating, or towel drying. Don't forget often missed spots like the tops of your feet, ears, back of your neck, and lips. Check the expiration date of your sunscreen, as its effectiveness can diminish over time. Avoid tanning beds and sun lamps. Artificial UV sources emit intense UV radiation that significantly increases the risk of melanoma and other skin cancers. There is no safe way to base tan indoors. Protect children. Sun protection habits should start in childhood. Keep infants under 6 months out of direct sunlight. Use protective clothing and shade. Apply sunscreen to babies over 6 months when exposure is unavoidable. Childhood sunburns significantly increase lifetime melanoma risk. Be mindful in special conditions. Take extra precautions at high altitudes near the equator and when surfaces like snow, water, or sand are present, as they reflect UV rays, increasing exposure. Even on cloudy days, UV rays can penetrate clouds. It's understanding treatment. Options by stage. If a suspicious mole is biopsied and diagnosed as melanoma, the treatment plan will depend heavily on the stage of the cancer. Staging describes how deeply the melanoma has grown into the skin and whether it is spread to nearby lymph nodes or distant parts of the body. Melanoma is typically staged from 0 to 4. Stage 0. At this earliest stage, the melanoma cells are only in the epidermis and have not invaded deeper. Treatment usually involves a simple wide local excision, surgically removing the melanoma and a small margin of surrounding healthy skin to ensure all cancer cells are gone. This often cures the melanoma. Stage 1 and 2. Melanoma has invaded deeper into the skin, but has not spread to nearby lymph nodes or distant sites. Stage 2 melanomas are thicker or have other features that indicate a higher risk of recurrence. Treatment. The primary treatment is wide local excision to remove the tumor with a larger margin of healthy tissue compared to stage 0, based on the melanoma's thickness. For stage IB and stage 2 melanomas, a sentinel lymph node biopsy may be recommended. This procedure involves identifying and removing the first lymph node that drained from the area of the melanoma. If cancer cells are found in the sentinel node, this means the melanoma has started to spread to the lymphatic system, which upstages the cancer to stage 3 and influences further treatment decisions. For some high-risk stage 2 melanomas, adjuvant therapy with immunotherapy or targeted therapy may be considered. Stage 3. Melanoma has spread to nearby lymph nodes or has spread within the skin or lymphatic channels more than 2 centimeters away from the original tumor, but not too distant organs. Treatment. Treatment typically involves surgery to remove the affected lymph nodes or areas of in-transit metastasis. Adjuvant therapy with immunotherapy or targeted therapy is often recommended after surgery to reduce the risk of the cancer returning or spreading further. Stage 4. Melanoma has spread to distant lymph nodes, skin sites far from the original tumor, or to distant organs such as the lungs, liver, brain, or bones. This is also referred to as advanced or metastatic melanoma. Treatment. Treatment for stage 4 melanoma is primarily focused on systemic therapies that travel throughout the body to target cancer cells. The goal is often to control the disease, alleviate symptoms, and extend survival. As stage 4 melanoma is generally not curable with current treatments, though significant progress has been made. Immunotherapy. Checkpoint inhibitors are a cornerstone of stage 4 melanoma treatment. These drugs unleash the body's immune system to fight the cancer. They can lead to durable responses in a significant number of patients. Targeted therapy. For melanomas with specific gene mutations, targeted therapy drugs can block the activity of these altered proteins, slowing or stopping cancer growth. These therapies are often very effective in patients with the relevant mutations. Combination therapies. Combining different immunotherapy drugs or combining targeted therapies is often more effective than using single agents. Surgery may be used in some cases to remove isolated metastases causing symptoms or complications. Radiation therapy can be used to manage symptoms such as pain from bone metastases or neurological symptoms from brain metastases. Chemotherapy. While less commonly used as a first-line treatment for melanoma compared to immunotherapy and targeted therapy, chemotherapy may still be an option in certain situations. Clinical trials. Participating in clinical trials offers access to cutting-edge treatments and contributes to the development of new therapies. Treatment decisions are complex and involve a multidisciplinary team of specialists, including dermatologists, surgeons, medical oncologists, and radiation oncologists. The specific treatment plan is tailored to each individual based on the stage and characteristics of the melanoma, their overall health, and their preferences. Looking ahead, prevention and early detection save lives. Melanoma is a serious diagnosis, but the progress in treatment, particularly for advanced disease, offers significant hope. However, the most powerful tools we have against melanoma remain prevention and early detection.
I'll make some.
Protection, a non-negotiable part of your daily routine. Get to know your skin through regular self-examinations. If you notice any mole or lesion that fits the ABCDE criteria or looks different from the rest, see a dermatologist promptly. Early detection often means a less extensive treatment and a much higher chance of cure. Thank you for joining us on HealthSphere. Protect your skin, be vigilant about changes, and prioritize your health. This video provides general information and is not a substitute for professional medical advice. Always consult with your doctor for diagnosis, treatment, and personalized recommendations regarding your health situation.